we know in penile carcinoma is that we can use different regimens. We do not have a standard of care, which is proved by prospective phase 3 trials. So we know that we have a lot of options. We know that we can use platinum plus other agents, which can be taxanes or fluorouracil, and we can use doublets or triplets regimens. But no data is available on which is best. Mostly we have retrospective data showing that there are some benefits in using one regimen over the other, or three drugs over two. This study showed that there may be a beneficial effect of using platinum plus fluorouracil other than taxane, and 3 drugs over 2. This is an important matter, even if it's only on in terms of progression-free survival, because of the patient that we are treating. In oncology, we like to see always a benefit in overall survival. Nonetheless, progression-free survival is very important in these patients, because we know that even if penile carcinoma can spread also in distant sites, in many cases the progression is local. So we have enlarged lymph nodes that cause pain, that cause discomfort. We have cutaneous metastasis in the area of the surgery. So these patients suffer from very limiting localization of disease. And even if this does not translate in a benefit in overall survival, to achieve a benefit in progression-free survival could translate into a benefit, a clinical benefit for the patient, and a benefit in terms of quality of life. So this is a very important message, a message that has to underline and has to focus the attention toward the better studies and prospective studies and randomized studies to obtain good quality studies on patients with this type of tumor, in order to find which can be the best treatment, because we have a little window of time in this patient. We know that this is an aggressive disease. We know that this disease spreads locally and causes discomfort, causes pain. Patient have a progression, have a performance status that rapidly decreases. So we have to take care of this patient when we have the possibility. And this possibility is mostly the first-line treatment. So we have to be able to choose the best treatment for this patient up front. And this study is very interesting because it recollects all the treatment strategy of the Italian centers. So what can we take as a take-home message is that we have to focus our attention on which treatment to use in order to improve patient quality of life and clinical outcomes from upfront. What really limits the improvement of these patients' outcomes is the scarcity of data that we have on this patient. And this is a very real and important problem in patients with rare tumors. What we can provide for this patient is the availability of clinical data. It is important to share opinion, to share clinical management, and to use this registry study, to use retrospective evidences to use the collaboration of referral and tertiary center to achieve shared knowledge on patients with rare tumors. And this is very real, very important for patients with penile carcinoma patients, because we need to know more. In order to know more on this patient, we have to share clinical opinion, to share clinical experience and this decision-making process among centers that treat this patient and have gained in time an experience with this patient, a clinical experience, a management, a therapeutic experience. So we have to share our cases. There are some studies that are highlighting the role of genetic factors, PI3K or other genetic factors, HRR, that seem to be mutated in a small percentage of patients. We also have some data on the HPV infection and the tumor microenvironment, especially in terms of tumor mutational burden and all the factors that could suppose that there could be a response to immunotherapy. So there are some studies that are highlighting the role of novel prognostic factors that, like other branches of oncology, are mainly genetic or on the tumor microenvironment to stimulate the immune response. And there are some studies ongoing on this matter. What is very important in order to find other prognostic factors and also predictive factors of response is that we are able to share the clinical management of this patient and work as a community, as we did in the Mituro group, in order to achieve a better knowledge on these patients.